Well, good afternoon, everybody. Again, my name is Art Terrazas. I'm with ACA, and I'll be hosting the call today. I want to thank you all for taking some time to join us this afternoon, and want to let you know that I think we've got Scott on here, but we're going to try and save his voice. He's been taken ill, so we want to get him on the road to recovery as quick as we can. So what we'll basically do for those of you who have not been on a call before, we're just going to run through a quick update of some of our issues, let you know where we're going on a couple of different things, and see if there's any progress on with different things on Congress, and then after that we'll go ahead and open it up to questions. One thing we'd like to ask you to do, though, is if you are on a cell phone, or if you're outside, or just in an area where there might be some folks walking around or doing things, if you could just mute your line by pressing *6. That helps clear up the whole call. Sometimes we get some ambient noise from different phone lines, and it's hard for people to hear each other and for us to hear questions that are being asked. So once again, just go ahead and punch *6 and mute your line. To unmute your line at the end of the call for questions, you can just hit *6 again, and that'll bring you back. So we'll go ahead and get started. I think the biggest, we'll start with VA and our issues there. First of all, if you have been sharing your stories on experiences that you've had with the VA, and or if you've been soliciting folks to send in stories about the experiences they had with the VA, we want to thank you very much. We've had a great reception from the membership of people who are telling us their experiences with the VA, and we want to make sure that if you do have those stories, keep them coming to us. But also, more importantly, or as importantly, we want to make sure that you're writing your members of Congress, your House member, and your U.S. senators, and letting them know about your experiences as well. The VA is still supposed to be filling these positions that they created back in April, or looking for ways to fill them. So we're in a period right now where we can really start to influence where they're going to go and which direction they go. Of course, as many of you remember, the VA talked about filling those 1,600 positions with marriage and family therapists and counselors, along with other mental health clinicians. But obviously, it's a window of opportunity we want to make sure that we take advantage of, and the VA works with us on. Another development that we've had, and you'll see coming up, and I think we might have talked about this before, but for those folks again that might be joining us, we have over the last year or so been trying to get some questions answered on the VA, with the VA, in regards to kind of what they're doing with counselors and why they're not taking certain steps, and it's been very, very difficult to get the VA to answer questions that we've had. And so when we've been talking to members of Congress, we actually encountered a member of Congress that's been very helpful and has actually authored a letter to the VA asking specific questions that we've been asking and haven't been able to get the answer to. And that gentleman's name is Mike Michaud, who is a congressman from Maine. Congressman Michaud, in the last Congress, was the chair of the VA's Committee on Veterans Affairs Subcommittee on Health, and he continues to serve on that committee and continues to be an advocate for veterans, and is now taken up a charge of being an advocate for us on the Hill on this issue. You'll probably be hearing more about this as the days pass on, because ACA wants to make sure that we're publicizing the fact that Mr. Michaud sent this letter. Want to make sure we're circulating that around to the membership, as well as we'll be writing a thank you letter to the congressman for his efforts. And as soon as we get a response back from the VA, we'll be working with his office to work on our next steps as well. Another thing that's coming up, we'll start next Wednesday, is the ACA Institute for Leadership Training. Some of you may be attending it and joining us next week. Others may be past attendees, and some of you all may be interested in taking a look at the website and seen learned a little bit more about the institute. But it's an annual institute that the ACA hosts here in the Washington D.C. metro area and here at Alexandria. And we have a lot of great different sessions that we present to help out, help educate leaders on different things like anything from running effective meetings to the roles and obligations that they have in their current positions or their upcoming positions. And part of what we do as public policy is we work to get folks prepared for the Day on the Hill, which will be occurring on Friday, the 27th. This is going to be an opportunity for counselors themselves to go meet with their U.S. senators and staffs and meet with congressional staff on the House side, and talk about our issues and why they're important to their different communities and to the counseling community, but also to the constituents for these federal lawmakers as a whole. And so we'll be taking folks up on the morning of Friday the 27th. We're really excited about that, and we hope that folks are looking forward to it as much as we do, and I'm sure that they are. But it'll be great because we have a chance for them to get some here, all year long. They'll hear from Scott and I, they being the congressional staffs, about these issues. But this is the first time some of them will be able to get face-to-face meeting with actual counselors and actual ACA members to talk about these issues. Scott, are you on the line?
Yes.
Okay. Do you want to go over Medicare, Medicaid, and ESSCP very quickly, and then we'll let you get some rest again?
Sure. Excuse me. Well, in order, on Medicare, we are continuing to try and see if we can find a House member, ideally a House Republican member, willing to introduce a counterpart bill to the bill that we have on the Senate side, which is S-604. We are hoping that some of the meetings that happen next week might generate a little bit more interest in members doing that. Again, as I think a lot of you have probably heard me say before, nothing is expected to happen on Medicare until December, essentially, until after the election. But there is going to be a Medicare bill of some sort that goes through Congress then, and it could serve as a vehicle for us attaching our provision to the bill. I don't think we've gained any recent co-sponsors on the Senate bill. That's something else that we would like to have happen. So we're hopeful that the meetings next week might give us a little more momentum. On Medicaid, I'm sure people have been hearing about debates in states as to whether or not they want to expand their Medicaid program. The Supreme Court decision 3 weeks ago or so upheld the Affordable Care Act, which we were very happy about. And as a result of the Supreme Court's decision, one of the upshots is that states have the option, but not the obligation, to expand their Medicaid program to essentially cover those people just above and just below the federal poverty level who don't have health insurance. Medicaid right now covers only a portion of uninsured individuals below the federal poverty level. The Affordable Care Act includes subsidies to states to extend coverage, and the provision that states are taking a look at right now excuse me, is to extend their current Medicaid program using almost completely federal funding. Initially, I think the funding is 100% from the federal government without the state having to kick in anything. That funding support from the federal government decreases gradually over, I want to say, 2 to 5 years. I need to go back and check, but it's something like that. The federal funding level would decrease from 100% down to around 90%. So the federal government would still, at the end of the day, be contributing at least 90% of the cost of covering low-income uninsured individuals. And a lot of states are considering saying no thanks to that. And that how that plays out is unfortunately becoming very, 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 very political. If there are state counseling organizations that are considering trying to weigh in on that debate, I'd be happy to talk to people and compare notes, provide resources, and work with anyone that is considering doing that. The last issue are listed, which is appropriations. The House Labor HHS subcommittee of the Appropriations Committee just came out with a draft funding bill for all the labor HHS and education agencies, basically those three departments of the federal government, today, and it appears to zero out funding for several education programs, including Race to the Top and state improvement grants and some others, and including the elementary and secondary school counseling program. The House Democrats appear very unhappy with the bill. It's not clear whether or not the bill is actually going to make it to the House floor, but it, if nothing else, sets a marker for how the House Appropriations Committee would like to spend or not spend money on education and health programs. The bill also zeroes out a bunch of funding for the Affordable Care Act, including the Prevention Fund. So this is one more thing that's going to get hashed out at the end of the year after the elections. Fortunately, the Senate's Labor HHS Appropriations Bill does include funding for the elementary and secondary school counseling program. It keeps funding at just above $52 million, about the same amount as was provided in fiscal year 2012. So we'll be trying to help support that Senate number as this issue moves forward. And with that, I think I'll stop and open it up for questions unless you have anything to add, Art.
No, I think just if everybody has any questions, we'll go ahead and start taking those now.
This is Robert Smith at Texas A&M in Corpus Christi. Could you talk a little more about the Medicare? You mentioned the bill that is the Senate bill, or is there a Senate bill?
Yes, there is a Senate bill. It's S-604. It's a bipartisan bill, which is kind of rare these days, obviously. It's been introduced by Senator Ron Wyden from Oregon, who's a Democrat, and Senator John Barrasso from Wyoming, a Republican and a physician, interestingly. It's the same language that passed the Senate back in 2003 and in 2005, and it passed the House in 2007 and 2009. So there's no policy debate about whether or not this is a good idea. It's simply a question of whether or not Congress wants to spend money on it. We would like to get a House counterpart introduced so counselors across the country can call their member of Congress and ask them to co-sponsor it and kind of serve as a focal point for the issue. So far, we haven't been able to convince a House Republican to do that, though. And we've always, over the years, worked very successfully to have the bill that gets introduced in a chamber be introduced by a member of the majority party of that chamber. Democrats are the majority on the Senate, so we have a Democrat lead sponsor. We'd like to get a bill introduced in the House this Congress by a Republican. And we've had a bunch of meetings over the last few months, and a lot of offices have said, well, yeah, that sounds like a good idea, and sounds like something we would support. But the hang-up is always that it involves spending a little bit of money. And people are very leery of spending any more money than they currently are on Medicare or anything else, frankly. The 5-year cost, the last cost estimate we got for this from the Congressional Budget Office was that the 5-year cost of the legislation to cover both LPCs and marriage and family therapists would be $100 million, and the 10-year cost would be $400 million, which, is, I guess, a decent amount of money. But in the context of a Medicare program that spends more than $500 billion a year, that's not really that much in the grand scheme of things. Medicare spends a significant amount of money. I think the estimates are something like 30% of Medicare spending is on people who have diabetes or services, supports, what have you, related to beneficiaries who have diabetes. So if you also factor in the fact that there are roughly 10% or so of people who have diabetes who also have depression, and the fact that people who have depression and diabetes wind up costing a lot more than people who have diabetes who don't have depression, if you improve depression treatment for Medicare beneficiaries across the board, and you do that for people who are eating up a decent amount of Medicare spending, you have the opportunity to reduce costs fairly significantly. Unfortunately, the Congressional Budget Office does not give us or anyone else credit for those kinds of cost savings. Factoring in those kind of cost savings is what's known as dynamic scoring, and members of Congress routinely complain about the fact that CBO doesn't do that, but CBO's job is to be very conservative in the cost estimates that they come up with, to try and make sure that their numbers are defensible and as cautious as possible. So we make the cost offset argument whenever we have meetings with people, but and then they seem to understand that. But at the end of the day, if a member of Congress introduces a bill that has a cost associated with it, you can be sure that organizations like the National Taxpayers Union and some of the other anti-tax groups that are out there will take a look at it and say, oh, well, Representative so-and-so introduced a bill that's spending this much money, and we've got huge deficits, and that's really irresponsible. And he's not going to get credit for any of the savings that are very likely to be associated with expanding access to outpatient mental health treatment. And under budget rules, if you're going to propose an expansion of Medicare spending, you either have to simultaneously come up with some sort of mechanism to increase taxes or cut other spending or someone else's ox to cover that cost. And that's something that a lot of members are pretty leery of doing, not surprisingly. So it's been a tough road to hoe.
Well, that's been very helpful.
Any other questions from the group?
And hopefully that situation that I just described helps make it easier to understand why it's so important that counselors talk to their representatives and their senators, because there's this kind of built-in inertia that they're not going to move off the dime and change current policy to get into these types of issues unless they know their constituents want them to do it. I mean, we've got the policy arguments for doing that, but in this kind of environment, that's just not enough. It needs to be something they're hearing from their constituents as well. Any other questions?
Yeah, Art and Scott, this is Greg. Greg Pollard from Ohio. Any update? And sorry if I missed it. I got on just a few minutes late. Any updates on Tricare?
On Tricare?
Yeah.
Not that we've heard. I have seen some emails about some information gathering that DoD is doing, and heard from a couple of people that they're being asked survey questions about the requirements and that they meet and their education and training background. Mm-hmm. But I have not seen anything yet about the Tricare region starting to certify counselors for independent practice.
Gotcha. Okay. Very good. Good. Okay. Yeah, I just wanted to check.
Sure. If anyone hears of anything like that, please share any information you think we should see with us, because we would not necessarily be the first ones to hear about that. So if any of you get a notice from Tricare or from one of the regional contractors, please feel free to pass that along to either Art or myself.
On that note, I got an email from it came out through our state association, through our listserv, from the National Guard down by Columbus, Ohio, and they want to have a meeting in August sometime about Tricare and counselors specifically, and getting like a list of providers.
Interesting.
And I can send you that email. I will forward that email to you, Scott and Art.
Yeah.
One of the things that I'm taking a look at, and I've sent messages out through the listserv within Ohio, and also through the Midwestern region. One of the problems I see a lot of counselors becoming very excited about that who will not qualify to practice. See, right. And so I don't think the word's getting out enough about that, because I still meet people and run into people who, they're just not going to qualify. I know that I'm not going to qualify, to practice within the network, even though I've been practicing for 15, 16 years, and So
there is a transition period under the Tricare regs.
Okay.
So I think there might be actually a greater percentage of counselors who can qualify for Tricare independent practice under the transition period requirements than can qualify for VA positions with the K-prep requirement. I mean, that's going to vary from state to state, but
right. So it's not as exclusionary as the VA, but there's still some regs in there. Could you send me anything that you have on that, Scott? Or I can get it next week when I see you.
Either one. I mean, if you want to shoot me an email, I'll reply back and send you attachments. But either one is fine.
I will do that. That's perfect. Thank you. Okay, great.
Yeah.
Awesome. Thank you.
This is Walter Dodd from Nebraska.
Hey, Walter.
I have a question on Medicaid.
Yes.
Will there be any kind of training for the associations at the Leadership Meeting Institute?
It's something that I'll talk about in the one of the sections that David Kaplan and I are doing for people. It's not something that you're going to be asked to talk to your members about on the lobbying visits. So it's I will be sharing some information, but it's not. We're not having a session specifically focused on that. If you'd like to get into it a little more closely, I'd be happy to work with you or anyone else that wants to get involved in that. It's a relatively new issue, obviously.
Yes, we have some senators that are meeting to discuss possible changes in Medicaid, but the governor is opposed to any kind of change. It's going to cost any kind of money.
Well, we'd be happy to work with you on that. There are, I think, a few governors that are pounding the table and making noise about, no, I'm not, this is federal government overreach or whatever, I'm not going to take this money. That I think at the end of the day we'll decide, well, yeah, it's too good a deal to pass up. We have a lot of uninsured people, so we'll grumble a little bit and make some noise, but at the end of the day, we will accept the federal money. I'm not sure if your governor is one of those, but yeah, we'd be happy to work with you to try and pressure people to do the right thing.
Okay. Thank you.
Any other questions? Art, are you still there?
Yes, I'm still here.
I just want to make sure I didn't accidentally hang up or something.
No. Well, if there's no other questions, I think we'll go ahead and wrap this up early. If you do have a question that might pop into your head afterwards, after the call's over, just go ahead and feel free to either send an email to Scott or myself, or give us a call here at the office. So, once again, thanks a lot for taking the time to join us today. We really appreciate it. And if you're coming in next week, we can't wait to see you. So thank you very much.